So this is a paper which is quite an interesting paper, which looks at can you predict LH surge, and it looks at a mathematical model to address it. Now, for ovulation, you require a successful FSH and LH secretion. Now, when you stimulate the ovaries, your main aim is to prevent the rise of LH. Now, in this review, the antagonist was used, and the antagonist role is to prevent the rise of the LH that's happened. So, what did this paper look at? It came up in Gynecological Endocrinology in 2024, and it looked at the factors that can predict premature LH rise in patients undergoing ovarian stimulation and what contributes to these risks. So, the exact mechanism of LH rise, or a mechanism that mediates an LH rise, is not fully understood. GnRH plays a significant role in controlling gonadotropin secretion, while estrogen has an opposite effect, so higher these on LH secretion. So as soon as the estrogen starts rising, there's a rise of LH, depending on concentration and duration of exposure. Now, if you look at a clinical challenge, what happens when you see a premature LH rise? You may see early luteinization of ovarian follicles, and the progesterone secretion can start rising, and you would end up canceling the cycle. So what was this review looking at? They looked at to identify clinical parameters that can predict premature LH surge or LH rise in patients who are undergoing ovarian hyperstimulation for IVF, and that helps to enable a successful cycle. They looked at perspective of 382 patients who underwent IVF treatment. Patients were divided into different age groups. A model predicting premature LH rise was based on clinical demographic parameters, and they looked at machine-based algorithm learnings. LH rise was defined as a difference between pre-trigger and basal levels, and LH surge was defined as the LH rise more than 10 international units per liter preceding ovulation trigger, and at least 1.5-fold increase from pre-stimulation levels. So what are the predictive parameters? Age, and age tends to be the strongest predictor in all groups. BMI, again, a significant predictor. LH levels at the start of stimulation and at the antagonist administration, total numbers of stimulation, and what you're looking at is a basal LH. If women had a high basal LH, then you effectively looked at a higher chance of premature LH rise. For the total group of patients, the LH rise was significantly predicted by these factors. So if you have a look at the age groups, in the older age groups, it did not seem to make a difference. So this graph is for younger women. And so what it tends to say is as you grow older, the predictive model is not very good. So this was based on a machine-based learning, and that's the reason why it is a different way of addressing and seeing how the LH surge would work out. So the surge definition would, again, a full LH surge is defined as an LH rise of more than 10 international units per liter preceding ovulation triggering, demonstrating more than a 1.45-fold increase. So using both these traditional statistical methods and machine learning, the team built models to predict the risk of premature LH rise. And they found that 5 factors stood out as strong predictors. The age, as women get older, a higher risk. Increased BMI, a higher risk. LH levels at the start of stimulation, higher the LH levels, the risk is higher. LH level on a day of antagonist was started. And again, the higher the LH level on the day of the antagonist, you may end up seeing the risk of having premature LH surge. Of these, the LH level at the start of stimulation was the most important predictor. The model worked better in younger women in ages between 25 and 30, where it could explain 88% of variation in LH rise. In women over 41, it was less accurate, suggesting that hormonal regulation becomes more unpredictable with age. How does this help us? One is looking at the baseline LH levels, weight, age helps us to identify patients at risk. In some cases, starting the antagonist earlier. In some cases, increasing the dose of antagonist in obese women. Optimal timing, better timing for ovulation trigger, and try and reducing the risk of having an IVF cycle cancelled.